Okay, so when you go to do collar care, you want to make sure you have a couple things. One, an extra set of pads, and then a person to help you maintain C-spine. If your patient has lots of tubes, intubated, or will have trouble staying still, you might need a third person to help watch their arms and their legs. So when we have our other set of pads over here, you want to make sure that you feel them with your bare hands. If there's any places of moisture or wetness, we cannot use those pads. We have to order a separate set. Any kind of moisture on the pads when placed on the skin can cause breakdown and chemical-like burns. So after I've felt with my hands the fresh pads that are completely dry, I'll go ahead and get my supplies for skincare. This includes 4x4s, baby soap, and that's all in some water. So I'll have a pile of gauze that has water and baby soap, a pile of gauze that just has water, and then a pile of gauze that's for drying, just like you would do in kind of like trach care or mature G-tube care. All right, so when I go to do my collar care, I'll obviously do hand hygiene, have all my supplies ready to go, and I'll put on some gloves. In real life, you'll have someone holding C-spine, but for here, Kelly's gonna hold still for us. So to take off the collar, what you're gonna do is you'll see this crank right here. If it's dialed up, we're gonna bring it all the way down for when it comes off. Take the Velcro, pull the Velcro off, and then slide the front piece directly off like that. In order to get the back piece down to minimize how much you move someone's neck, you're gonna take your hand and you're going to push into the bed while sliding the collar out, okay? Now that the collar is off, you're gonna do a really good skin inspection and look for any kind of skin breakdown. If you do notice any kind of skin breakdown, burns, or beginnings of pressure injuries, you're gonna wanna note that and then be prepared to put some Meplite on those areas of injury. So what I'll do, and this is Soapy, I've assessed her skin looks good. We'll clean with the Soapy, the water, and then dry with dry gauze. You wanna make sure that you get all over the chin, neck, chest, and then press into the bed to get the back of the neck. If you do find any areas of injury, breakdown, or burns from the collar, you're gonna wanna put Meplite on the injury, the area that you see. If you put it on one side, you must put it on the other side to make sure there's an equal balance of pressure. Kelly's skin looks great, so we're not gonna do any type of Meplite, but if it's there, just to know that. Okay, in order to put the collar back on, we have to reassemble the pads. Here are my pads. When reassembling the pads, it's important that you put them on the right way. For reference, white goes to skin, gray goes to the collar. It will only stick on this one way. Only the gray side sticks to the Velcro, the white side will not. So if it's not sticking, you've got it on the wrong way. When putting the back piece of the Vista, you're gonna line up the triangle with the triangle in here, put it here. You put the strap through the big hole first, loop it, and then go through the back piece. Same thing on this side, go through the big hole first, and then through the side piece, and then that's the back collar put together. For the front piece, you have two pieces. Think the bigger piece goes on the area of the body with the largest surface area, which would be your chest. The smaller piece goes on the chin. In order to kind of get more equal distribution, I'll kind of fold it over like this. The notch here is gonna match the notch in the Vista, so you can put it on like that. Don't worry about it being perfect. We can always adjust it as we go. This goes like this. Put that somewhere in the middle, and then we can kind of like Tetris it together. What you're looking for is pretty equal distribution of the collar and making sure that no areas of plastic are gonna touch your patient's skin, because that's where skin breakdown happens. So if we look here, this looks pretty good, and your collar is ready to go. If you have a patient that does not stay very still for collar care, gets agitated easily, or is intubated, I would just get a whole separate collar ready to go. That way you're not going to waste time undoing all of the parts and putting the new pads on. So when we go to put our collar back on, what we're gonna do is I always tuck this strap over, and just like the reverse, we took it off, we're gonna push into the bed to slide the collar over. Make sure you get her hair out. So then I'm gonna, when I look at the back piece on her, I wanna make sure that both sides are equal out from her neck and that the straps are in between her chin and her shoulders, right in the middle there. The front piece, just when we took it off, we want to make sure it's rolled all the way down. You can tell that it's rolled all the way down because you'll see this little white circle is at the lowest position. As I roll it up, you'll see that the white circle moves to different dots. So when we go ahead and put this collar on, you're gonna think about going up over their shoulders and scooping this around the back of the neck. A lot of times we can't get a good fit, it's that it's not scooped around enough. We're gonna go on, we'll go up over her neck. I'm gonna press pressure down and scoop around the back of her neck. I'm gonna hold pressure on the front as I pull up the tabs on the side. From here, the collar is on. I wanna make sure that I can get 2 fingers snugly in between the chest and the collar. She needs it cranked up, I would say at least 1. That's pretty good. If you need to readjust the straps after you've cranked it, you can. The plastic part of the chin piece should be flush with her chin. It is, that means you've got a good fit. Before I sit her up to check the fit, I'm gonna make sure that all of the pad is rolled down and there's no plastic part touching her skin. It looks great. I'll go ahead and sit her up and make sure that her chin doesn't recess back in once I sit her up. So when she sit up, it looks great. I also want to make sure that her face was midline, her head was midline with her body. This collar looks very appropriate, the fit is good, and collar care is done. In order to wash my dirty pads, I'm going to use water and soap. We want to use room temperature water or cool water. Any kind of heat on these pads will cause them to shrink and they might not cover the plastic appropriately. So I'll wash them, squeeze out the water, and let them air dry in the room. And that's collar care. We also have the PED 1 through 5 and the adult short. The process of doing collar care, changing out the pads, washing the pads, doing skincare is all the same. The only difference is checking the fit on these type of collars is slightly different. As you can see, the height is fixed. The plastic does not move up or down, so this size, it's the only size that's gonna happen for the patient. When you check the fit on these collars, you're gonna see here on both the adult short and all the PED collars, there are circles. One has just the green dot, other ones have a white circle or a white circle and a green dot. When putting the collar on and putting the straps on, you should see both sides completely cover the green dot. If it's not covering the green dot, you don't have a good fit. On the pediatric collars, you'll see there are dots on the chin piece here. When this goes on the patient's, underneath the patient's chin, if you can see these dots, the fit is also not good enough because their chin is too far back to be showing these. Same thing for their chest. You want to feel, for little babies, 1 to 2 fingers snug between their chest and the pad down here. When putting an adult short or a pediatric collar on, and aka anything but the Vista, the process of sliding the back piece on is exactly the same. To make sure that it's fitting, that both dots are covered. We know the back piece is on correctly because the Aspen is reading up. We have our chin piece flush with her chin. I can fit 2 fingers snug underneath the chest piece. So that's how we check the fit on the other collars.